Hello, my name is Xavier Aguilar, and today I'll be doing a teaching presentation on medical law. Some legal issues that can arise in the medical field in radiology is HIPAA and OSHA violations. For example, giving out or speaking about patients and violating their patient confidentiality would be a legal issue. Another situation that could lead to legal issues in the medical field would be performing an examination on the wrong patient. This is why patient verification is so important. In radiology, we usually ask the patient's name and date of birth and ask them to confirm it, also double checking their wristband, and we like to confirm that the exam we are doing is the same as the order. Performing the wrong exam on a patient is an act of negligence. Battery, for example, is the intentional violation of a patient's right to direct their own medical treatments. Battery can also deal with wrongful physical contact with a patient without their consent. Respondo superior is a Latin phrase which stands for "let the master answer." This is a doctrine that states that a party is responsible for its agents. Res ipsa loquitur is another Latin phrase that means the thing speaks for itself. This is based on the principle that an accident is due to negligence. Now I'm going to be talking about restraints versus immobilization. Restraint refers to using physical force to hold a child without their consent. Immobilization refers to keeping a child still with their consent. Both of these methods are used in radiology and can make for a better diagnostic image. In other words, restraint is to hinder the movement, while immobilization is to deem immobile. Now we're going to move on and talk about the manipulation of electronic data. This refers to things such as post-processing, brightness and contrast, exposure index, and things like that. The exposure index is a numerical parameter used in computer radiography to inform operators about the amount of exposure to the imaging plate. Brightness and contrast are adjusted by window level and window width. Both of these techniques can be used to make the image more diagnostic and easier for the radiologist to read. Cropping or masking off anatomy can be used in order to prevent the radiologist having to read more than what the patient was sent for. The last topic of my teaching presentation will be the ARRT Standard of Ethics. The Standard of Ethics is one of our governing documents. It articulates the type of behavior we expect of RTs and describes the types of behavior that they will not tolerate. In conclusion, this has been my teaching presentation on medical law. I hope you enjoyed it. Thank you.